My name is Jill Berry Bowen, CEO of Northwestern Medical Center and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics of interest to our community. Today, I'm joined by Jane Suder. She's NMC's Manager of Care Management, and we're going to be discussing things to think about as you begin caring for a loved one who's in need of extra help at home or whatever setting. So thank you, Jane, for being here. It's such an important topic.
It is. Thank you for inviting me.
Yes. So is this your first time?
It is my first time.
Well, so the viewers want to know who you are and what you do at Northwestern Medical Center. So please introduce yourself.
Thank you. So as you stated, I'm Manager of Care Management at Northwestern Medical Center. I'm a multi-generational Vermonter, grew up in Burlington, have lived in St. Albans for about 5 years, have actually worked at Northwestern for 14 years.
Wow.
About 3 in this position. I've been a nurse for 40 years, which doesn't seem possible. And I have my master's in healthcare administration and my certification in case management.
Wow. What a fantastic career. That nursing was the base, wasn't it?
It was.
That's terrific. So what is care management? What do you do as a care manager?
So care management is really making sure that people are living the best quality of life that they can in the appropriate place and level of care with the resources that they may need. So really making sure that people can stay or go to whatever level of care they need and be there safely and have quality of life.
Wow. That's wonderful to be able to wrap around the community that way and help them on their life journey.
Exactly.
That's terrific. So how big is the team and who's on it? So what makes up your team?
So at the hospital, our team only has 5 people, which doesn't sound like a lot, but we do a lot.
Yes,
so
for sure.
We are comprised of both social workers and nurse case managers. So we have Kevin, who is in the emergency department as an RN care manager, and he helps people coming into the ED who might need resources on their way back home, or we can help get people sometimes to rehab from the emergency department. And we have an RN care manager in the oncology arena. And so even though that we at Northwestern don't have an oncologist ourselves, she will help people that have cancer and help them find resources, help them get money or medications if they're having issues with that. We also have 2 people on the inpatient side, a social worker and an RN care manager, Amanda and Bobby. And so we see all the patients that come into the hospital that are on either in the birthing unit or on our progressive care unit to assess and see what their needs might be and help them with their discharge planning process.
So it sounds like in that process, you have to be collaborating with other community partners.
Definitely.
What does that look like? How do you make that all happen?
So we collaborate with pretty much everyone in Franklin County and every agency or place where there may be resources. We work closely with home health agencies, with all of our rehab facilities and nursing homes, and with all the primary care practices. So most of the primary care practices within Franklin County have social workers and care managers themselves in those offices, and we connect with them to make sure that if someone needs help once they're discharged from here, that the office, the doctor, and those case managers know what's going on so that they can follow up. So that's the whole point of transitions of care that we facilitate.
So you do connect with like the primary care office and and how we manage the patient together?
Yes, so we have really close relationships with all the primary care offices. We know all of their case managers and social workers by name. They're used to contacting us. I help as manager of care management for the hospital. I help them get resources or find resources if people don't know or have questions, to help people stay at home and to help facilitate outside resources. They'll even connect with me even though they're not, the patient isn't in the hospital. So we deal with or work with the SASH nurses, which is the services and support at home. So many of our senior housing areas have SASH nurses that work in them. We also connect with them so that they know what's going on with their people in their buildings. We work with Age Well, which is the Agency of Aging for Vermont. And so there are many resources that people that are disabled or over 65 can get. And so we connect with them to get Meals on Wheels, to get social workers maybe that, or case managers that can go into the home to help with other issues that we weren't able to do on the inpatient side, because people aren't in the hospital very long these days.
Yes.
So there's only so much time. And so we again connect people so that they can figure out what they might need and get more help at home so that they can stay at home and be safe.
So is there any way that people can plan ahead? So before they get to the hospital, I mean, you often don't want to think about it, that you might need other types of resources, but it's so nice to know them in advance and you can actually plan ahead. Is that even a possibility? And how would you go about doing that?
Yes, in fact, it's my wish that more people would do that.
Well, tell the viewers how to do it so you'll have more of them ready.
So I think people feel when they're caring for a loved one or a family member or friend that they're doing it alone and that they have to do it alone. And there's so many resources that we have available. And what I see by the time they come into the hospital, they just feel so overwhelmed that they don't know what to do anymore. And so one of the reasons I'm so happy I'm here today is to let people know that they don't have to get to that point by themselves, that they can contact their primary care office and let them know what's going on. And the primary care office can help facilitate a home health referral so that they can get nursing and they can get therapy and they can get social workers to come in and again help them be able to stay at home and help their caregiver not feel like they're doing it on their own and they don't know what else to do. So if someone's weak and getting weaker, then having therapy at home is a great resource and a great idea. The other piece that people can do is to make sure they have an advance directive, which actually allows people to pick their healthcare agent. So if they can't speak for themselves regarding their health care, and that means whether they're unconscious or whether they're just so confused that they can't speak for themselves. And I think people wait too long. And then the person is too confused and maybe it's, dementia or Alzheimer's, and so can no longer make that decision and can no longer sign those forms to identify who that healthcare agent should be. So it's a difficult conversation, but it's even more difficult when someone comes into the hospital and is acutely ill. I think it makes it harder because you're already dealing with someone being really sick, and now you're having to deal with this information that if you do it when people are well, it's much easier. And if you can have that person decide who their healthcare agent is, and then have that person write down what they really want as far as, do they want feeding tubes? Do they want to have CPR done? Do they want to have, a tube and be on a ventilator? What exactly are their wishes? It just makes things so much easier.
And it all starts with that call to the primary care office.
Exactly.
To get those discussions started proactively.
Exactly. And we ask, when people come in and we see people, we will ask everyone if they have an advance directive. Okay. And we give information out every day. Okay. There's a short form or a longer form. And the short form is actually really easy. And that, again, helps identify the healthcare agent and identify what their basic wishes are.
So someone that can speak on your behalf and fulfill your wishes.
Right.
Designating that in advance.
Yep, and making sure that whoever you decide is your healthcare agent really knows what your wishes are, because they're speaking for you.
They are, and carrying out your wishes. So that's great to do that well in advance. So I know that folks, if you do need to go to another level of care, like whether it be skilled care or nursing home, do you still have to wait in the hospital? Do you have to have the hospital admission? What's happening around that?
So we're really lucky here in Vermont right now because we're in the midst of a Medicare waiver. Okay. And I look at rehab as a benefit, which is what it is for Medicare patients. So if you have Medicare insurance, it used to be that you needed a 3-night inpatient stay to be able to have that benefit kick in. And that benefit allows people to go to rehab for, up to 100 days. With this waiver, we no longer have to wait for that 3-night stay. Now, some people still may need to, because the waiver is part of what we call the Accountable Care Organization, or the ACO. Most people, however, in Franklin County right now fall under the ACO. So there are very few now that would have to wait that 3 nights. And when people come in, or again, the primary care office could let them know if they're a member. And what this waiver allows us to do is, if someone is at home and they have home health, or maybe they talk to their primary care provider and have no medical reason for being in the hospital, but they're getting weak and they need a little rehab that home health feels is beyond their capacity, that they need more rehab than they can give them, then we now are able to get people into rehabs here directly from home. Which is great. And so even from the emergency department, or if they come in observation, which is not inpatient, and so it messed up that 3-night inpatient stay, now we can send people to rehab if they're in the ACO from home through. And so the exciting part is, again, that they can get services before having to come into the hospital. So we'll see people come into the emergency department who can't walk. And maybe that has been progressive, maybe it just happened.
Sure.
But the only reason they're there is because they can't get out of bed or can't get out of a chair, which clearly they need to do at home.
Right.
And so we will now refer people to the rehabs, and we're lucky because all 3 rehabs here in Franklin County are a part of the ACO and qualify. And there are a couple down in Chittenden County that qualify as well. So we wait to get a bed offer, and we can get people right into rehab without having to come into the hospital.
Wow. That's such a beautiful change.
Oh, it's wonderful.
It used to hold us back so much, and it was frustrating for everyone. So
exactly.
So our time flies, and you've shared so much fantastic information. So how do people get in touch with you or your team so they've listened today, and now they want to reach out and make those plans, or make those connections, or get to those resources that are there?
So the first thing I would say is, if you do have a primary care provider in our area, I would call that office and ask to speak to either the social worker or the care manager there.
Okay.
However, we're always available. Okay. And so probably the best way to contact our department is actually to go through our operator and to just have one of us paged, or to have them put people through to our phones. We're not in the office a lot because we're seeing patients.
Right, that's right.
And so paging us is probably one of the best ways because we get that wherever we are.
So if you wanted to reach you, to call the hospital operator and have them page a care manager.
Exactly.
Especially if they don't remember the names. So I page a care manager.
Exactly.
Or call the primary care office and ask to talk to the care manager or social worker.
Exactly. Yep.
Okay, fantastic.
Yes.
All right. Well, thank you so much. This is a lot of great information and important. We don't want to always think about it, but if the more prepared we are, the smoother it will go in that transitions of care that you're talking about, or adding those resources that you might need to keep you at your highest function.
Exactly. And the more that people can be proactive and do it up front, the easier it will be, even if they do come into the hospital, because they'll have a plan and it won't seem so daunting.
Yeah, that's fantastic. Thank you so much.
Thank you.
I'm Jill Berry Bowen, CEO of Northwestern Medical Center, and your host of the Health Beat Show today. And, if you're thinking about needing resources, or a loved one needs resources more, start planning and reaching out now. Call the hospital and ask to talk to a care manager, or call your primary care office and make those connections with your social worker or care manager. That's what we're here for, is to help you on your life journey. Thank you.